Ladies and gentlemen, welcome to this very special segment. Yes, and today we have Aapki Sehath. And in today's episode, we'll be speaking to Dr. Vagish Singh. Let's join that segment.
Hello everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin, practice in this wonderful sunshine state of Queensland. They volunteer their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and is meant for information and education only. Please note this is no substitute for your own healthcare professional, and everyone is advised to their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMA Queensland, Dr. Cyril Fernandez, to introduce to you our guest speaker of this month.
Welcome listeners to another episode of Aapki Sehath program, meaning your health of the Indian Medical Association of Queensland. Today we have a listening pleasure of Dr. Vagish Singh, an eminent, well-experienced cardiologist. Dr. Vagish Singh is also the president of the Indian Medical Association of Queensland. Eli has already spoken to you about the public health message from IMA, Indian Medical Association, Queensland. So my first question to Dr. Vagish would be like this. Dr. Vagish, welcome to the program. Can you please tell us about your educational, professional background, your experiences in this field of medicine, especially as a cardiologist doctor? Please, Dr. Singh.
Thank you, Cyril, for inviting me today for this program, Aapki Sehath. It's my great pleasure to be here. Yeah, I have a fairly varied background. I did some of my schooling in India, in Mussoorie and Lucknow, and finished my secondary school education at Brisbane Grammar. Then I qualified for the University of Queensland, did medicine here over 6 years, and then specialized in cardiology over a period of 10 years at Royal Brisbane Hospital and Prince Charles Hospital, and got my fellowship of the College of Physicians and the fellowship of the College of the Cardiac Society of Australia and New Zealand, and I did some further training overseas as well.
Oh, that's a lot of experience, Dr. Vagish. Look, heart health is an important matter leading towards overall health and well-being of a person. Please highlight on this heart health, Dr. Singh. Cardiology being your area of specialization, you can give our listeners more insight on this, Dr. Singh.
Heart health. Coming for the Indian population, for the population of the Indian subcontinent, we are at 3 times higher risk of coronary disease. And therefore, heart health is more important for us than the local population. This goes for all immigrant communities in the Western world, Australia, New Zealand, Canada, US, and UK. So it applies equally. So heart health for us is more important. And one of the major reasons why our risk is so high is we have diabetes, which is exceedingly common. 1/3 of all urban Indians, even in India, have diabetes. And certainly we are genetically predisposed to truncal obesity. We are genetically predisposed to low HDL levels, which are protective cholesterol levels, and we have high triglycerides, which probably go hand in hand with diabetes. So that's why heart health is important for the Indians. There are major risk factors, other risk factors that apply equally to all of us. The major risk factors are the hypertension, diabetes, smoking, dyslipidemia, and family history, obviously. There are other risk factors as well. And Dr. Salim Yusuf, Professor Salim Yusuf from Kerala, who's now in London, Ontario, Canada, is one of the pioneers of cardiac epidemiology. He published about 15, 20 years ago a paper from the InterHeart study. and he identified the traditional risk factors. In this particular study, there were 54,000 subjects. 54,000 subjects. All the traditional risk factors were mentioned. But what was interesting was the lack of fresh fruits and vegetables was a risk factor, and the lack of alcohol was a risk factor.
Oh,
yeah, so 1 or 2 alcoholic drinks a day is cardioprotective.
Yes, so healthy eating, alcohol in moderation, no smoking, a lot of exercise is good for heart well-being. That's a good message what you are giving our listeners. Look, Dr. Vagish, see, we GPs tend to have interest in some areas at some point of time. So as a cardiologist, I'm sure you will be having a special interest in area of your cardiology field. So can you please highlight on that for listening pleasure of our viewers, please?
Yeah, I trained in electrophysiology and pacing. That was my area of subspecialization. And after about 3 or 4 years of practice, I gave up the idea of electrophysiology because electrophysiology advanced very, very rapidly, and I concentrated predominantly on pacing. So I did some further training in pacing in the US and in Europe. And also, when I gave up my electrophysiology, I concentrated more on imaging. So I did some further training in stress echocardiography and cardiac CT. I'm one of the few cardiologists that reports on cardiac CT. And I just did a fellowship in Huntsville, Alabama, over a 2-year period intermittently. And so that was very useful. I still report cardiac CT. And I've been reporting nuclear cardiology for close to 25 to 30 years as well. So imaging forms a big part of my practice. And pacing is a big part of my practice as well. And I do normal pacemaker implants as well as biventricular pacemakers as well as biventricular ICDs as well. So I cover a large area these days, which modern cardiologists probably would not cover.
Yeah, that's good knowledge for our listeners, because we know that we have come a big way ahead from our past days. Like nowadays they say clinicians are skilled technocrats. So we have different digital modalities, multimedia, diagnostic means, like what you have delineated just now, which helps in better diagnosis and management of heart conditions. So thank you for highlighting on this, Vagish. Now let me ask something, and the viewers would like to know, what are your hobbies out of medicine, Dr. Singh?
I mean, I love to travel, and obviously because of the recent COVID over the last 12 to 18 months, travel is severely restricted. I have been out of Australia since February of 2020, when I was in the US, when COVID was not even thought of. People were asking questions, and the important people in power were saying it was just the flu. And I mean, other thing that I enjoy, golf when I get time. Unfortunately, it takes too much time. I love to play tennis, but once again, time is a major issue. And I love reading as well. And reading about geopolitics is fascinating. And these days we have plenty of ammunition when it comes to geopolitics.
Oh, that's really good to know that you're finding time for all this. You must be missing all your international conferences, is it not, due to the travel restrictions?
Yeah, international conferences I do miss them greatly, but I have been trying to keep up to date by attending the virtual conferences online, which is not the same because one cannot interact with your peers as much. But still, it helps me keep up to date. I enjoy the experience, and some of the knowledge I shared at one of the recent meetings about the recent advances in cardiology with our IMA colleagues on the Gold Coast. I mean, I have an interest in preventive cardiology as well, so being part of the Australian Atherosclerosis Association, I'm a member there. I'm also a member of the National Lipid Council of the US. I'm also a member of the European Society of Cardiology, amongst various other memberships as well.
That's good to know, Vagish, that you have a great Indian history background, wide range of experience as a cardiologist in Australia. Now the take-home message for our viewers on a healthy lifestyle, cardiac health, overall well-being. Dr. Vagish Singh, please give us a few words from your wisdom and experience. Thank you.
Yeah, the most important message I have, the most important risk factor really is healthy eating. Most of us, we live in a world of plenty. We have too much. And in the old days, it was feast and famine. And now what we have found amongst our Indian population is there's always a feast. And as we become more affluent, we tend to assume a diet that is richer in saturated fats. We need to reduce the carbohydrates. To reduce weight, one has to reduce the size of the portions and the calorie content. So that's one. Regular exercise is important, 4 times a week, up to between 20 to 30 minutes. That's especially cardiorespiratory exercise is important. And certainly, these would be the mainstays. Keeping the alcohol in moderation, having no more than 1 or 2 alcoholic drinks a day, and for women, probably just 1 is enough. And obviously, the obvious risk factor is one should not smoke. Yeah, and
thank you, Dr. Vagish, for sharing with us your vast knowledge and giving our listeners good insights on heart health, overall health. On behalf of the Indian Medical Association of Queensland, we extend to you thankfulness. Thank you, Dr. Singh. Thank you very much.
Thank you, Cyril, and thank you for having me on your program.
Thank you, listeners.
So, ladies and gentlemen, that was a very, very special conversation with Dr. Vagish, presented by Indian Medical Association of Australia, Queensland chapter, and conducted by Dr. Cyril Fernandez. And of course, we know that heart is such a vital organ, and I must make a very special mention right here that today I'm a survivor of that, because it's due to the medical advancement and to the great work done by the cardiologists that I'm here talking to you people. Otherwise, I probably won't be here after my heart attack. And there's so many people we will. So some of the very wonderful tips that have been given, alcohol in moderation, exercise, and of course watching what you eat and keeping fit is some of the tips. So ladies and gentlemen, this has been a very special presentation of Australian Medical Association of Queensland, and of course it is wonderful that they bring a very special segment every month, which is the first Saturday of every month at 10 a.m. on this program, and it will go to air, which is the Australian Indian Radio online version, audio only, tomorrow on the radio. So you can listen to that. And of course, if you have missed any of the episodes, you can always go back to our YouTube channel and Facebook channel and catch up with all the previous episodes presented by Indian Medical Association of Australia's Queensland chapter. So once again, ladies and gentlemen, we'd like to thank IMIQ and of course Dr. Cyril Fernandez, and today's very special guest on our wonderful topic, Dr. Vagish Singh. Thank you very much for being on the show.